Why are so many young people drinking alcohol in Rwanda? The government is raising the alarm after revealing that more than 95% of young people admitted for addiction treatment are battling alcohol abuse. Rwanda's Ministry of Health recently confirmed at least 50 deaths in the first half of 2026 from illegal and substandard alcoholic drinks. So how did alcohol become one of the country's biggest youth health challenges? And how is the government tackling the problem? That's what's coming up. I am Eddie Micah Jr., and you are welcome to Africa Link, the podcast connecting you to the stories that matter. It usually begins with just one drink, but for some young people, it ends in a rehabilitation center. Rwanda's youth alcoholic crisis is no longer just a health issue. It is also becoming a social and public safety issue. For some young people, the problem begins early. Research suggests the average age of first alcohol use is around 13 years of age. That's way too early, isn't it? Let's get more from Elvis Benimana from the Health Development Initiative involved in helping people go through rehabilitation. I also have DW's Alex Ngarambe in Kigali. Welcome both of you to Africa Link. Elvis, alcohol accounts for more than 95% of youth admissions to rehabilitation centers in Rwanda. That's a very big problem, isn't it?
So, thank you, Eddie. Well, as you have just stated, this statement is certainly concerning because it tells us that substance use disorders, of course, particularly those related to alcohol, are the main reason why young people are being admitted to rehabilitation centers. And I can say that it also indicates that substance use is a big issue and a significant public health concern among people, young people in Rwanda. But also importantly, we should try to view this not only as a law enforcement or social issue, but more of a public health and development issue, which requires coordinated action from different systems, including health, families, schools, and communities. And also at the same time, I would emphasize in interpreting this figure more correctly, if I can say, because it reflects the profile of young people entering rehabilitation services. And this doesn't mean that it's 95% of all the young people in Rwanda, they are using alcohol or drugs, but rather suggests that many individuals, a significant number of individuals are accessing treatment only after their substance use has progressed to a level of addiction, if I can say.
I think that's very important what you're saying, and we will definitely dig into the solutions moving forward. Why are so many young people drinking alcohol? What really is driving people to do so?
All right, thank you. So from our experience working with communities, we have got to learn that there is really one single reason why a young person begins using alcohol or drugs. So substance use is usually influenced by a combination of individual, family, social, and environmental factors. So through our engagement with the same communities, including people who use drugs themselves, we have seen that peer influence and curiosity can play a role, especially among adolescents and young adults, where the desire to belong or experiment can lead to initial use. However, continued harmful use is often connected to deeper challenges that can include stress, mental health difficulties, trauma, or using substances as a way of coping with difficult situations. But also, family and community environments are also important because limited communication, family conflict, lack of support systems, or exposure to substance use can also increase vulnerability and influence young people to start using drugs. And another important factor is availability. Because when those substances, including illicit alcohol and other substances, are easily accessible, young people are more likely to be exposed, especially when those substances are at a lower price and young people can afford them. It can also be a reason to influence young people to start using those drugs. So this is why addressing substance use requires more simply than telling young people not to use drugs or alcohol. So we need to explore and understand the different factors that can influence a young person to initiate drug use.
Right. Thank you very much, Elvis. Really key information you're sharing with us. I'm going to come to you, Alex, because you've been on this topic for a while. You've been talking to young people and you're seeing on the ground how it's affecting people. Share a bit of that with us. How is alcohol abuse affecting young people in these communities?
Thank you, Eddie. True, the young people have been really sinking into alcoholism and drug abuse, and it has had a negative effect in society, definitely. And it goes across the board, across all age groups, teenagers, young adults. They are all involved in one way or another in consuming one drug or another, and the big number ends up in rehabilitation centers, like Elvis was saying. The biggest effect maybe on society could be that we see really young teenagers dropping out of school, first and foremost. We see very young adults losing their employment just because they have become addicts. And if they lose jobs, if they drop out of school, then they become a menace to society. This is when you start seeing criminality increasing. That's when you start seeing all sorts of petty crimes and a little bit bigger crimes. And these are kids who are taken, some of them, the lucky ones, end up in rehabilitation centers. But there are those who end up in other detention centers, which may not be necessarily rehab centers. Some are going to end up in transit centers in very bad conditions. Some are going to end up in prison as well. So the effect is going to be there. The families are going to lose their young children to addiction. And the young adults who are in employment in the labor force are going to drop out of this labor market, and the productivity, the general productivity to the economy is also going to be affected. And I may not necessarily agree with Elvis when he says that cheaper alcohol is affecting the majority. Yes, of course, so many people don't have, or so many young adults, so many teenagers who are sinking into alcoholism may not have a lot of money. But again, on the other divide, there are these, the well-off-to-do families, the well-off-to-do kids. They have a lot of money, and they will not go for this cheap alcohol. They are going to go for these expensive whiskeys imported from abroad. And these are equally as young. So, the well-off and those who may not be well-off, they are all equally affected. Those who don't have the money, they will buy the cheap alcohol. And those young adults, those kids from the well-off-to-do families will buy the expensive drinks. So it is a problem widely cross-cutting.
Right. I'm just thinking, Elvis, when you're dealing with an alcohol abuser, what does rehabilitation really entail? What exactly are you doing to this individual to get him or her back on track?
So thank you for the question. First of all, if a person needs rehabilitation, mainly it comes out of a problem like substance use disorder or an addiction problem. So a person is most of the time admitted in a rehab center when they have started showing signs that their lives, their respective lives are, if I can say, getting out of track. So if a person is suffering from addiction and their normal way of living, like going to school, going to work, has started to be disturbed, what rehabilitation does is to support a person to get back to normal life, if I can say. But by doing so, we are not only responding to, if I can say, the consequences of addiction, but also we tackle the root cause of what initiated the addiction in the first place. What made this person to start using drugs? And what factors led this person to start abusing the drug that they were using? Because sometimes consumption starts from a person trying to deal with normal stresses of life or the loss of a good one. So the causative factors vary depending on the person or the situation they are living in. We try to tackle all those factors that led that person to into addiction. And this requires a multi-sectoral collaboration, including healthcare providers that are trying to deal with the negative health consequences that go with addiction. Also, mental health professionals, if the victim or the client is dealing with multiple stressing, causative and stressing factors, and also as a way to come back into the society. This will include social reintegration. That's when the family of the client will also be convinced, and we try to address this problem in a multi-sectoral way.
That's really deep, what you're sharing. What's the cost of rehabilitation? I mean, it sounds like it involves a lot. How affordable is it for anyone who feels that they need help to get rehabilitated?
Well, the level of rehabilitation also varies depending on the gravity of the problem, if I can say. For example, if it's a person who is trying to deal with heroin addiction, for example.
How affordable overall is rehabilitation? Normally don't like to use the word ordinary. Is there a more affordable way for someone to go through rehabilitation if money is of concern here?
There are other centers, like it is a psychotherapeutic center, which is providing rehabilitation support for people who are heroin addicted, for example, and the cost is under the health insurance, and people only get to pay 10% of the total cost. But this time it will be an outpatient form of dealing with this issue. But the cost will increase when the client is required to be inpatient.
Right. Yes. Thank you very much for that, Elvis. Alex, isn't that one of the challenges that young people are facing, that even if someone really feels that they need help, outpatient or inpatient? Alex, to what extent is that the problem, that it's not cheap to get rehabilitated?
Yeah, I think I have a feeling, and I believe that rehabilitation is quite expensive in Rwanda, especially the one he talked about, the one rehabilitation center he talked about in Huye, where he was talking about inpatients and outpatients. It is quite expensive. And if you look at the people who go there, they are real people who society would think they have the money. But let's even talk about what you don't want to call the ordinary people. He talked about being insured 10% because the biggest majority, let's say over 95% of Rwandans are insured. There is that local insurance scheme in Rwanda. But again, it has been the insurance fee, the annual insurance fee has been increased in the next financial year. And the majority of the populations across the rural country, they are talking about how it is going to really be out of their reach. Some of them, actually, they are still complaining that the government could reduce that fee for them. So the cost of accessing the rehabilitation center is quite high, and the rehabilitation center that this is talking about, the inpatient ones, they offer the best services. So anyone who has the money, any family that has the money would prefer to take their child there because they are going to access quality services, quality rehabilitation services. But the other centers, of course, they are not all at the same level. So the cost is still quite up there.
Right. Thank you very much for that, Alex. And what is the government saying about how it can contribute to people getting rehabilitated? Is there any plan for the government to help people even more? I mean, when this whole alcohol addiction information came up, we saw direct action from authorities to go and, arrest people that were involved in illicit alcohol, to stop people from producing these products and all. Is there any plan that you sense that the government wants to help people go through rehabilitation?
Yeah, even I think the mere fact that these rehabilitation centers are in place, it has been the joint effort of the government and organizations like HDI. They are working together. So the government has the goodwill to put in place such facilities to help maybe these addicts and people in that line. And there are other measures apart from the rehabilitation centers that have been established. There are other measures in place to try and help and curb this addiction and alcoholism and drug abuse. So the government has been putting in place quite a number of measures. And whether they are working or not, it's a different topic altogether. Because even these rehabilitation centers, you can't say 100% they are going to rehabilitate somebody. So it is a continuous effort. It is a continuous effort by the government and stakeholders like HDI and others. So they cannot sit back and leave it at that. But closing and imprisoning, I don't agree with the method that was done, how it was done. Because these manufacturers have been given the license by government for over 7 years. And if the government gives you the license, it is upon the government to do the follow-up, periodic inspection, if these licensed factories are still doing the job they were licensed to do. So I have a feeling if they wake up one morning and close over 150 companies, over 100 factories, that is going to be the solution. Because these are factories that have been employing people. These are factories that have been paying taxes. So waking up and closing them because there is a problem, yes, there is a problem. We can see that and we acknowledge there is a problem. But is that the right method?
I guess the jury is out on that. If they were involved in doing something illegal, then I guess authorities should try to tackle it. I guess your point is the shutdown the real solution, or could there have been other ways? Which is a fair point. But I'm going to come back to you, Elvis, because at the end of the day, the government clearly is trying to do what it can to prevent alcohol addiction from getting out of control. Is there a way to focus on prevention even? Prevention, they say, is better than cure, isn't it?
Well, yes, of course. Prevention is also part of a crucial part of the response to dealing with substance abuse and addiction. And I can also recognize the efforts done by the government in different outreaches that are done in various schools, youth centers. I think we have every sector in Rwanda, most of the sectors in Rwanda have one or two youth centers where they give youth-friendly services and information. But also, in addition to prevention, we also have people that are already affected. That's where also I will recognize the efforts done by government, because we have different guidelines that are coming in to deal or to support people that are being affected by addiction. I can also recognize the initiation of the Kigali Mental Health Referral Center, which is one of the centers providing opioid agonist therapy to people that are struggling with heroin and opioid addiction.
I guess the question is, are these enough, right? Or what more needs to happen now to tackle the problem of alcohol addiction?
First, recognize that there are efforts that are being done. The second will be to decentralize. So is everyone, either a parent, either a community member, either a local leader, are they aware that there are available services to support people that are struggling with addiction? Are they aware of different messaging that are used to deal with alcohol and substance abuse? So increasing awareness to anyone at every level is crucial to ensure that this issue is appropriately faced. So the gap now I can talk about is decentralizing already available services that are being given to people that are directly affected by this issue.
That's a fair point to make. Elvis, if I am an alcoholic, if I'm addicted to alcohol, what do you tell me now?
The first thing I will tell you, and the first thing I tell everyone that is coming to HDI with a similar problem is, I hear you, I understand you, and I'm ready to listen to you. That's the starting point to anything that involves dealing with someone who is struggling with addiction. Could be alcohol, could be opioid, it could be other drugs. The first step is to listen. When you listen, you will know what the person is going through. You will know the possible causative factors. You will know the best way to refer. You will know the exact service, the exact rehabilitation center, the exact facility, or maybe what that person needed at that moment is someone to listen.
That's a very good point. That's a very good point, and that's a very good point, and I'm glad you shared it with me. What if I change what I say? What if I say, "Hello, Elvis, I don't have money. I cannot come to a rehabilitation center, whether as an inpatient or as an outpatient, but I know I need help." What do you tell me?
In a few words, is if you come to HDI, of course we support, because we do provide support for people dealing with addiction, both referral support and financial support to these people, and also we aim at rebuilding the connection with the families to ensure sustainability of the support.
I don't have the finances. I need you to tell me something that can help me deal with this in 30 seconds, please.
What I will tell you is I hear you out. And if you want to start this journey of recovery, I'm here to support. I'm ready to listen to you. I'm ready to assist in the best way we can to afford the services that you are going to need so that you can get cured. But also, we'll need to try to reconnect with supporting systems, either family or community friends, and any other person that can be able to support. But for now, we are together, and I'm going to support.
Right. Thank you. Thank you very much for those words. Would you not just tell me to stop taking alcohol?
Well, I would say that that's not how it works. Because there is a reason you started, and there is a process you go through so that you can be able to stop. Telling you to stop will not solve what caused you to start in the first place. So how did it start?
That's a good point. That's a very good point. And I think I got the response I assumed you would give, which means I'm understanding this topic more and more. Thank you very much for that. It means you've taking your time to explain this very well. Elvis Benimana from the Health Development Initiative, which is involved in helping people go through rehabilitation. Thanks a lot for sharing your insights with us. And DW's Alex Ngarambe, our correspondent in Kigali. Many thanks to you too.
Thank you, Eddie.
Thank you, Eddie.
Africa Link, every weekday here on DW.
No doubt, alcohol abuse is a serious problem, and the ripple effects are many. Some youth in Rwanda share their thoughts.
This challenge is big. It cannot be addressed by just rehabilitation alone. We need stronger prevention efforts through public awareness campaigns, education in high schools and universities, parental guidance, community engagement, and enforcement of law regulating sales and consumption of alcoholic drugs.
The biggest percentage of the youth in rehab is being addicted to alcohol. It shows that there has been lack of regulation, and alcohol was everywhere. Everyone could access it at a cheaper price. Let's say less than $1, you could get an alcohol, and most of it made of ethanol. It shows that the regulation was lacking.
Rwanda seems to be responding to the problem. Authorities recently shut down 8 distilleries, revoked every import license for industrial ethanol in the country, and arrested 50 people over illegal production. It is being described as an aggressive public health response to a genuine emergency. And hey, if you or someone you know is struggling with addiction, please reach out to a trusted health professional or a local support service. Share your thoughts on Facebook and TikTok at DW Africa. Listen to us on Spotify or wherever you get your podcasts. And subscribe to our DW Africa YouTube channel so you never miss an episode. This show was co-produced and edited by Isaac Mugabe, and I am Eddie Micah Jr. Thanks for listening.
DW. Made for minds.